Hi, my name's Jenny Owens, and I'm founder and executive director of a social venture called Host for Humanity. Host for Humanity provides housing for families traveling for medical care in people's spare bedrooms, so it's kind of like an Airbnb or a hotel with a heart. This venture was inspired by my son, who was born with congenital diaphragmatic hernia, a really rare condition that was undiagnosed, and we spent his first 3 years in and out of the ICU locally at both Hopkins and Maryland. I live in Baltimore. Through his time in the hospital, we met a lot of families who were struggling with housing on top of really large health costs. And I got really obsessed with this issue, which isn't well documented, and just thought I have to do something about this. And it became a really healing and powerful project of agency. My son now is 6 and doing amazing and is in kindergarten and learning how to read. So I feel so much gratitude for the amazing care he got here in Baltimore. And I wanted to help be a portal for others who also need that care. So since then, I've recruited 40 hosts locally in Baltimore, and we've hosted almost 100 individuals for 1,400 nights, saving families about $135,000 in comparable housing costs. For my strategic initiative with the Robert Wood Johnson Culture of Health Leaders program, I'm hoping to scale to 2 additional regions, and we did a lot of work during the pandemic to increase our operations and our platform to be able to do that. So we're really right on the cusp of expanding to DC Bethesda as well as St. Louis. COVID really impacted our operations as opening your home to strangers during a pandemic became a different experience. It really changed the nature of our core operations. And so what we did is we took a step back. We took a pause and looked at how we could do things better. And we built a platform that allows guests and hosts to connect more independently. We're really excited to be launching that platform now. Our vision for this project is a national one, and hoping to continue to scale the service so that we can provide access to healthcare to a population that often doesn't have it. Sometimes individuals are traveling and they become ill in a city that's not their own. So this helps build a community around them. Sometimes folks exhaust local resources and they have to travel further and further for the care they need. So my vision for this venture is to be there for them, to provide access from a lens of health equity, and also to look at advocacy work, how we can best support families accessing the healthcare that they need.